About 4 out of 10 Americans already use alternative medicine. And with the health reform, that number is going to continue to increase. I'm Dr. Ross, and when patients ask me,
Dr. Ross, who do I talk to about health insurance?
I recommend they call Tony Prince at Physician's Choice.
To schedule an appointment with licensed insurance agent Tony Prince, call 949-614-7096.
And our show today is sponsored by Physician's Choice Insurance Services, and this is Tony Prince, the president of Physician's Choice. Nice to see you.
Nice to see you, Ken.
You brought along a guest today, Dr. Yelena Wood. Welcome. You're an internist, correct?
I am. Nice to be here.
Welcome. I have a question right out for that. A lot of times you have somebody who's an internist. Is that a different than a primary care doctor? Is there?
Well, the primary care doctor is just kind of a big specialty, and internal medicine is one of the subspecialties of primary care.
Okay.
So internal medicine, we're specialists in adult medical care. So our entire training is based on the adult patient versus something like family medicine. They also, in the same amount of time, trained in the treatment of children, pregnant women. So we are the super specialists of the adult, or we'd like to call us doctors for adults.
All right. Well, as we know, Tony, in just a short amount of time, will be that, I guess they call it the election period, whatever you call it, but it's where people can change their plans with Medicare. There's a lot this year. Not only that, we have the addition of the Affordable Health Care Act, which is going to play a role in this. Yes, for the people who have Medicare, there might be not as much of a role in it, but there definitely is. And so many different plans out there. Part of that, you not only consider the plan, but you also consider your primary care physician as well, that first person, that your first contact that you'll see.
Right, exactly. And so many people who are just getting on Medicare or are not on Medicare yet and are getting the Affordable Care Act covered California plans, when we're talking to them about it, because the enrollment is going to start pretty soon, they're saying, I haven't had a lot of my preventive services done in the past, so I'm going to need to go see a primary care doctor, and I don't even have a primary care doctor. So they're using our resources to find who would be a good primary care doctor in their area for the specialty of the conditions that they might have.
And doctor, you are also a primary care physician.
Exactly.
You're an internist that you specialize, but you also act as that. You're one of the people that can be considered here when people are going for these new plans and for a doctor. I would imagine it's a benefit for people who live in this community to choose internal medicine doctor as their primary care, because you're kind of getting a 2-for-1 there, aren't you?
Exactly, because we take care of the adult patient, as I mentioned earlier, so we're well versed in all the chronic health conditions that come in the adult patient, issues with kidneys, heart disease, high blood pressure, diabetes, so on and so forth. So we are definitely, the specialist for the adult patient.
Tony, as we make our way into this new time meaning the Affordable Care Act, and also, of course, the time to get your plans in order, we look at this community and we think everyone here must be on Medicare, but that certainly is not the case. The people who live in this community, you can live here at age 55. So there could be a good amount of people here who are still working. They may not have adequate medical coverage. So a big block, this new Health Care Act that's going to take effect now, will really benefit them, won't it? There's a lot of people who in Orange County who will benefit for this.
Right. They estimate 200,000 people in Orange County will now have access to affordable health care that didn't have it before. That's a huge amount of people. And practically every day in the newspaper, you're hearing about another company saying, we're not going to offer health insurance anymore to our part-time people. So that wasn't even included in the 200,000 people. So there's going to be even more than that many. And all of those people are saying, I need to find a plan that works good for me, and then I need to find a doctor, that's in this area that will be able to either take over from where my group insurance was, or if I haven't seen a doctor in a while, I need to get caught up on all my preventive services.
And doctor, what is you'll probably be getting some new patients soon. What is your priority when you first meet with them? Is it just getting their medical history, getting their background, any sorts of problems that they're currently having, and I would also assume the type of medications that they may be using?
Definitely the first visit is really acquiring all their health information, their family history, their past medical history, any medications that they may be on now, and any health issues they're experiencing or have had experienced in the past, and setting up an individualized care plan for that person. Of course, including their current issues and all the preventive services that may pertain to them at their age.
And as Tony said, along with this is what has gone into effect here is although with people on certain medical plans, there may be little to no copay, but for a lot of these people, even with the Covered California, for preventative checkups, like we used to call them, there's no copays, correct?
Right.
So you're going to probably get an influx of people coming in that even maybe some current patients you have to say, you know what, it's been a long time since I've had a physical.
Exactly. So we try to really, keep track of that on a regular basis and make sure everyone's up to date on their colonoscopy screening, breast cancer screening, their cholesterol screening, diabetes screening, all the things, and definitely blood pressure screening that may pertain to them in particular.
If somebody comes into you and they check out pretty good, you don't see any obvious problems, and they're relatively young, maybe 60 to 65 or so, when would be the next time they should come in and see you? You still have those annual checkups, or if they're doing pretty good, is it 3 to 4 years? What do you usually suggest?
Unfortunately, Medicare does not cover any physical exams. So after age 65, that makes it a little hard to do a quote-unquote physical, although over 65 we see patients regularly, so we're kind of keeping an eye on them on a regular basis. But a healthy, 62-year-old who comes in with no blood pressure issues, cholesterol issues, heart issues, I think an annual visit would be definitely important to do to keep track of these, because blood pressure changes on a regular basis. Cholesterol may change, especially if there's weight changes. Blood sugars can change. So we definitely have to keep a close eye on everyone. And I think an annual visit for a quote-unquote healthy patient would be, definitely important.
And I would also assume you're going to get people coming in that because of inadequate health care, they may have had conditions that have gone untreated for quite a while. They have not had a way to the funds or the proper insurance to help them out.
Yeah.
And you almost have to play catch up with some of these people.
Definitely, and it becomes, you have to be very organized and make a great, like I said, individualized patient plan for that patient. I was telling Tony recently, I saw a patient in the office who did not have health care for a few years, and we found many health issues, including high blood pressure, high cholesterol, bladder cancer, unfortunately, an aneurysm in their abdomen, so many issues. And the patient now is trying to catch up and seeing all these specialists to catch up on all the health care that he missed over the years. So there's a lot of patients out there, unfortunately, that hopefully we will capture now and be able to provide good health care for.
And Tony, this is something that you can help with. Obviously, you help with the Medicare plans. We've known that, but also these new plans that are coming out. In some ways, it could be just as difficult to wade through them as with the Medicare plans. They have different levels of service and different costs, both for the upfront costs and like any health plan, you can choose different levels and how much you want to pay out per month versus how much your copay is going to be. But this is something that you're going to be covering these plans as well.
Exactly. And the people who are already on Medicare have used our services for years, and they really enjoy the fact that they can call a licensed insurance agent and can help them select which program will work the best for them, depending on what doctors and hospitals they want to go to and the medicines that they take. The same thing goes with the Covered California, the Affordable Care Act programs. for the people that aren't 65 yet, that we can help them select those as well. And a lot of the families here in Laguna Woods might have one person that's on Medicare, but another person isn't on Medicare in the household. And in cases like that, they don't have to call 2 different insurance agencies. They can just call one, and we can help them with both of those things.
Yeah, that's very good. Now, people who may go on to the Covered California, is there an age limit? In other words, if they get to be 65, are they automatically have to be on Medicare, or does it, if they're still working perhaps, is that a difference there?
Well, they would be eligible for Medicare when they're age 65. They would still be eligible if they would like to get Covered California as well.
Okay.
Because of the fact that we have such great Medicare programs here, it will be just certain people that have certain situations that would pick the Covered California over some of the other Medicare options that they would have. But it's nice to know that those things are available.
All right. And doctor, I understand you're going to be moving soon?
Yes, we're going to be moving to the heart of San Clemente at 724 South El Camino on Monday. So Friday's
very
our
nice.
big move day, yes.
Where are you currently?
We're also in San Clemente by the
Okay.
hospital, so we're just moving closer, to a different location, a new
Okay.
building.
All right.
So,
Still the same area, though.
Same
pretty much
area,
same
yes.
area. All right. Well, if you want to look at all these plans, get more information on them, a lot of new stuff out there this year, give Tony a call. The number's on the screen, 949-614-7096, Physician's Choice. Thank you very much.
Thanks, Ken.
And nice to see you.
Thank
Nice
you.
to meet
It's
you.
a pleasure to be here.
We'll see you next week.
All right.
All right. We'll be right back.
I'm Dr. Judy Nguyen in Laguna Hills. I have many patients who care for a loved one, such as a spouse or parent. I remind them that without assistance, this burden of caring for a loved one can take its toll on the caregiver. To help them find out what plans are available to help relieve this burden, I refer them to Tony Prince with Physician's Choice.
To schedule an appointment with licensed insurance agent Tony Prince, call 949-614-7096.